in this video we're going to be doing the manual muscle test for the lower trapezius. So I'm going to start by taking my partner's arm and draping it forward off the edge of the table here. The muscle's action in this position, so it's upwardly rotated and it's slightly elevated. So as he activates it, it's going to be doing some depression and retraction in a upwardly rotated position. So I'm going to show him the action. That's basically bringing the arm up right out in front of you. A lot of people give this the name doing a Superman, as the arms are reached out, stretched in front of you. So that is going to be the action of this muscle. It has nothing to do specifically with the glenohumeral joint, but it is moving that scapulothoracic joint as he moves his upper extremity. So let's get you to do that one more time on your own. That is going to be our active range of motion. Okay, for our break test, we're going to bring him part way up into this action. It's going to be fairly close towards end range, maybe not right at the very end, so we're still in that mid range. I'm going to place my palm of my hand on the spine of the scapula, one hand here, and I'm going to place my other hand below the lowest attachment, so I'm on the lumbar spine. My resistance is going to be trying to push this scapula forward and away. So there we go. For 5, 4, 3, 2, and 1. Excellent. Now you can relax your arm back down. And now he's going to lift up his arm and that scapula against my resistance. Whenever you're ready. Keep going all the way up. Good. So that is going to be the manual muscle test for the lower trapezius. All right, so we're going to be doing the length for the lower trapezius. It's a little bit tricky to get a full length for this, but ultimately what I'm going to try to do is bring this tubercle, the spine of the scapula, as far away as the spinous process of thoracic 12, since that's the lowest attachment of the lower trapezius. So what we're going to try to do is I'm just going to take his scapula and kind of hold the T-spine, and I'm going to push that scapula forward and down. So we're trying to effectively lengthen this portion of trapezius out for the lower traps. So that it's not really an easy muscle to lengthen out. You could, in theory, have the arm at the side to try and keep the downward rotation of it. But again, having that scapula elevated and then trying to push it down, I just find having the arm overhead allows you to bring it further away. So you're getting more of a lengthen out of that lower traps. So that will be the length position for our lower trapezius today.